వామ్ విషెస్ టు ఎవ్రీబడి. చాలా రిక్వెస్ట్లు వస్తున్నాయి పలానా టాపిక్ మీద చెప్పండి అని. వన్ మోర్ టాపిక్ తర్వాత అది అప్లోడ్ చేస్తానండి మీరు అడిగింది. ఈరోజు మనము లంగ్ యొక్క అనాటమీ. దిస్ ఈజ్ ఆల్సో ఏ వీడియో బీయింగ్ అప్లోడెడ్ ఫర్ మెడికల్ రిలేటెడ్ స్టూడెంట్స్, బోత్ అండర్ గ్రాడ్యుయేట్స్ అండ్ పోస్ట్ గ్రాడ్యుయేట్స్. మన లంగ్ అనేది వేర్ ఈజ్ ఇట్ కమింగ్ ఫ్రమ్ in the embryo and how is it growing, final shape of the lungs in the adults ani teluskuntu we'll know the parts of the lung, that is anatomy of the lungs today. Okay, see, now we are going to know the anatomy of lung. In the embryo, as you see here, there is only single one, that is called food and airway tract, which divides into two, that is esophagus and the tracheal bud. On the transverse section also you can see how it is getting separated. As you go down, the pulmonary bronchial buds will come two, because there are two lungs, we have two buds in origin. They have covering with the splanchnic mesoderm. Finally, these buds will convert into these lungs. The right lung and the left lung. Blue color is upper lobe, green color is lower lobe on the right. On the left, the color red color is the lower lobe. This is basically because of two fissures, one oblique fissure, one horizontal fissure. As you see here, again the lobes are divided into various segments. As you see, the right is having three lobes. The upper lobe or apical lobe is converted into anterior, apical and posterior segments. Middle lobe is divided into lateral and medial segments, and the lower lobe is having 5 segments. On the left side there are only two lobes, upper lobe and lower lobe, and there is another one called lingula. The upper lobe is having apico, anterior and posterior segments. The lingula is having superior and inferior lingula, and the lower lobe is having 4 segments. Why should we know about all these segments and lobes? Because depending upon the localization of the disease, the treatment changes. Positional physiotherapy is an important treatment modality for bronchiectasis disease. Likewise, if there is a malignancy, which lobes to be preserved, which segments have to be harvested, removed, will be known when you know the anatomy of the lung. Okay? Sarve jana shukino bhavantu.